I have knee problem, Vasudevan sir writes, but can sit in Sukkah Asana, cannot fold knees for Santulan and Natraja. Have also lower back pain, TB of one middle vertebra some 18 years ago. So can this problem be addressed?
It can be addressed very, what you say, very easily. So you can't sit in certain pose. For that, you need certain flexibility of your body. Now, flexibility of the body happens because of what? So you see a young person, that young person becomes old. Does that person loses flexibility? So what has happened? Hua kya? If you touch a young person and if you touch an old person, what is the difference? The young person is warm, the body is warm, but the old person's body is cold. So you have lost metabolic heat during the process of aging. So without body movement, can you sweat? Can you increase the heat of your body without moving your body? I'll tell you a method. You hold your breath as per your capacity and keep holding it many times. You'll see your body will become warm. क्या किया आपने? कुंभक करके आपने एक metabolic heat बढ़ा दी अपने शरीर. But suppose we also diagnose you. Suppose we find that your liver is not functioning properly. Then we'll give you certain methods like 1 unit inhalation, 1 unit hold, 4 unit exhalation, and it will start rejuvenating your liver. If your detox process is not proper, that means kidney is not functioning properly. There are a lot of toxins. Because of that also, there is joint pain. And the flexibility gets lost. So the detox is not happening properly. So what we'll do? We will invigorate certain aspect of your body. Spleen को हम invigorate कर देंगे. And kidney को करें. So 4 unit inhalation, 2 unit hold, 1 unit exhalation, your kidney will start rejuvenating. तो क्या इसको हम हैंडल कर सकते हैं? बहुत आसानी से कर सकते हैं. But you have lost certain factors, strength of your body. If you increase those things, your body can create any kind of solution.
Okay, Vasudevan sir writes about any solution for urinary problems.
Urinary problem may happen because of few things. दो तीन चीजों के बारे में बता देता हूँ. The first thing is your urinary bladder. The nerves in the urinary bladder has become weak, or you have a nerve issue. अगर आपके nerve का issue है, you are a person who gets into anxiety very easily. यानी आपकी life में, in your life, if there has been lot of adrenal overactivity, then your nervous system becomes weak, and that nervous system also helps in the movement of any organ or your limbs. So urinary bladder has a mesh of nervous system which helps it to expand and contract. So if your nervous system becomes weak, obviously you will not be able to hold. The second factor, if your body has a lot of toxins, it generates a lot of metabolic toxins. For example, your glucose in the blood is basically a toxin. For diabetic people, the glucose, higher glucose in the blood is basically a toxin for the body. The body creates frequent urination and thirst to throw out that waste. Then you will face frequent urination. But that doesn't mean you have a nerve issue for a short period of time. For a long period of time, if you have diabetes, then you will get into a nerve issue. But if you have diabetes, if you take care of your metabolism, your nervous system will remain intact and the strength will be there, and you will not get into any neuropathy. ठीक है ना? So if you rejuvenate your nervous system, you'll see your metabolism as well as this issue will be taken care. Third thing is, I talked about Nagvayu. Urinary system is also unidirectional movement. It has a factor of Nagvayu associated with it. So there are people who get into urine infection, UTI, urinary tract infection बहुत जल्दी होता है. And you take medicine, antibiotic, and you become fine, and again it comes up. So it is very difficult to get rid of UTI. Now, why? Because if you do not correct the Nagvayu, your urinary system will not get into the kind of a functionality that it needs. Every functionality needs a certain energy. हर काम के लिए पीछे कुछ ऊर्जा चाहिए, एनर्जी चाहिए. वो एनर्जी है, अगर आप नहीं दे पाएंगे अपने सिस्टम को तो काम नहीं कर पाएंगे. तो नागवायु gives that dynamic energy to the urinary system. We also suggest certain methods through which you not only can come out of your urinary disorder, but also people who face any kind of sexual disorder. And that may also happen as a result of urinary issues. So I can talk about it from many perspectives. बहुत सारे तरीके से बात कर सकते. But the thing is, I am just exploring it. बता रहा हूं आपको हर तरीके से. It will not help. When we diagnose you, we come to know about what has gone wrong. क्या प्रॉब्लम आ गई, और फिर हम उस हिसाब से आपके कस्टमाइजेशन करते हैं. That is actual solution.